So here's our first example question that we're going to use to try out the tootRN 3-step. We want to get used to utilizing those steps because that's the method that you're going to utilize to answer questions. So let's read the question together first. The question reads, a client has a BUN of 68 milligrams per deciliter and a creatinine level of 6.0 milligrams per deciliter. The IV fluid is 5% dextrose and 0.9% sodium chloride with 40 milliequivalents of KCl at 100 mL per hour. Which action would be most appropriate for the nurse to take? Option A reads, encourage more protein in the diet. Option B reads, ambulate the client to increase circulation. Option C says, take vital signs every hour. And option D says, question the use of potassium in the IV fluids. So our first step is to identify what the question is asking us. So plain and simple, what's the ask? And we can actually find the ask here because it says which action would be most appropriate for the nurse to take. Now, something that's really important that I like to do is to make the ask as simple as possible. So though it says which action would be most appropriate for the nurse to take, make it simple. It's really just asking you what to do, right? So our ask here is, what do you do? Now, step 2 is we need to find the problem. Now, remember that the problem doesn't mean that there's always something wrong. The problem really is just taking the data, all the data that the question is providing you. So you know what your scenario is, or in other words, you know what the problem is, what you're working with. So this question's telling you the client's got a BUN of 68, they got a creatinine of 6, they're getting IV fluids, it's 5% dextrose, normal saline, it's got 40 MEQs of potassium, and it's going at 100 mLs an hour. So that's the data that we have. Now, step 3, looking for the solution. And how you do that is by considering what the outcomes are of your problem and what the outcome would be or end result of your answer options. So first thing, looking at that problem data, you want to think about expected outcomes. And we do that here by applying your nursing knowledge, by analyzing the information that you're given, by using your nursing intuition to look at the information and say, this is what's going on, and this is what's going to continue to happen to my patient. So first thing, the problem, outcomes of the problem. If the client has a BUN of 68 and a creatinine of 6, what do you think about that? Take a minute. That means there's something wrong with their renal function, right? It's totally right. So they have an issue with their renal function. They're getting IV fluids. Okay, no big deal. It's 5% dextrose and normal saline with 40 milliequivalents of potassium in it. What do we think about that? Well, if this client has a problem with their renal function and they're getting IV fluids that has potassium in it, that seems a little wrong. Because if your kidneys aren't functioning properly, then how are you going to filter out that potassium? It's going to be quite difficult to do that. And we don't want the potassium to build up because then you're going to become hyperkalemic and that can turn into a big cardiac issue. So that's the outcomes of our problem. We're thinking potassium, not a good idea for someone whose labs is telling us their renal function is not looking too great. So now we want to look at our answer options and think about those outcomes, meaning what's the end result going to be of each and every single one of those answer options? What is it going to do for the patient? What's it going to do for the problem? And did I satisfy my ask? Now, here is where I like to think about this as a choose your own destination type of deal. So what you're really doing is looking at each one of those answer options and you're determining where is it going to take you? How is it going to end this story? Was it the right thing to do? So A says encourage more protein in the diet. Well, if this client's BUN and creatinine level are so high, it's telling us their renal function is impaired, encouraging more protein in the diet is not going to be a good idea for them. Also, think like a detective, right? Think intuitively with your nursing brain. What does this have to do with this IV fluid information that they gave us? What does it have to do with the BUN and creatinine level? It's not going to help the kidney function. and it's not related to that information about the IV fluid. So I'm going to get rid of that. B says ambulate the client more to increase circulation. Okay, so we want to move around more to increase circulation. Doesn't seem like a bad deal. But what does that have to do with the client's BUN and creatinine level? What's that have to do with the IV fluids that we have? Nothing. It doesn't help their renal function, and it's not going to help with the IV fluids that they're given. So that's not what we want to do. Take vital signs every hour. All right, so we can take their vital signs. Fantastic. But again, bringing it back to the outcomes and bringing it back to the data that we know, what's the end result there? What's it going to do for that BUN and creatinine? What's it going to do for those fluids? Nothing. Now, D says, question the use of potassium in the IV fluids. So we got to think outcomes. Question the use, meaning that we think that's not the right thing to do. Well, what's that do for the patient? What's that do for the BUN and creatinine? A lot. Because we recognize BUN and creatinine are really abnormal and tells us there's something wrong with the kidney function. And if we give them this particular fluid with potassium in it, they're not going to be able to excrete that potassium out. And so it will build up and the client can become hyperkalemic. And that can lead to cardiac issues. And cardiac issues can lead to death. So the thing that we want to do is question that. Question that fluid because it's not going to be appropriate for this particular patient. So our correct answer here is D.